Good afternoon. I'm Tom Valenti, President and Chief Operating Officer of Blue Sky Health, and I want to thank Senator Colbeck for inviting me here, but also thank him for his guts on this issue, because we have a chance to reform our system, all of us here. And it's not a matter of changing the insurance system, it's a matter of changing the delivery system. And I'm going to give a boots-on-the-ground perspective of how Senator Colbeck's bill will benefit patients, providers in the state of Michigan, and through direct primary care. It's time to reinvent Michigan. You know, we can do this. It doesn't take an emergency manager. And if we look at our costs, the next slide, please. If we look at our costs, 75% of our costs are due to chronic conditions, largely preventable. Those are conditions like diabetes, high blood pressure, high cholesterol, conditions that a lot of us have, but those that can be treated through a lot of time, coaching, disease management, but they can be cured largely without drugs, without surgery. And it falls on primary care in order to make that happen. So what we should be doing is supporting primary care in order to make primary care as good as possible so that we can affect these costs in the best way possible. But we have a medical system that doesn't allow primary care to do that right now. Next slide. We have created a bottleneck, and that bottleneck is the result of government saying that healthcare is paid based on CPT codes. The government has decided how things are going to be paid for. And for primary care, they've decided that the only way primary care providers are going to get paid is if they see patients face-to-face. So you've created this bottleneck system where now it takes 2 weeks in the Detroit area to get an appointment. You look at Boston, what they're facing, which way we could be heading, and this bottleneck doesn't have to happen. We need to free doctors to treat patients in the best way possible. And let me expand upon that in the next slide. What do I mean by freeing doctors? Well, there's a lot on this slide here, so I don't want you to read everything. But MQIC is Michigan Quality Improvement Consortium, and they set guidelines, quality guidelines, for how best to care for patients. This is a patient that has diabetes, high blood pressure, high cholesterol. And these are the guidelines that they've set forth and how to properly care for that patient in a given year. And these are all the things that patient and primary care provider need to do. And if you look at this, there's quite a lot to do here. It can't be all done in a 5-minute appointment. So you can now see how that 75% of cost and chronic disease spiraling out of control is largely because we can't even fix it when we do have time to fix it. And also what we can find in this slide is that most of these things don't need a face-to-face visit in order to get done. Only the two things highlighted in yellow really require a face-to-face visit. The rest can be done in other ways, through technology, through phone calls, through house calls, through non-physicians, nurse practitioners, health coaches. It doesn't have to be this way. And what we can do then through direct primary care is free physicians, free primary care providers to provide care in the best way possible, most efficient way possible, and the best way for the patients. If you think about a Medicaid patient, they have difficulty. We have a 25% cancellation rate of Medicaid patients. That means, or a no-show rate. They're not even canceling. They just don't show up. That's because they don't have a ride to the doctor. They can't get child care. They can't get out of work. And if we can provide a different model, a way of more efficiently providing their care, then we can actually do this in a way that provides better convenience to them. And what we need to do is then free doctors to be able to do that. In the next slide, we can do better, and we need to reinvent Michigan. That's what the governor says, but I don't understand how you can reinvent Michigan without actually changing the healthcare delivery system. What we should be doing is starting from scratch. You know, if we were to design a system from scratch, would we come up with CPT codes? Would we come up with reimbursement? What other industry talks that way, or it gets paid in those ways? To show an example, if banking system functioned like healthcare, you would have to call up your branch and actually get an appointment with a branch manager in order to deposit a check. And you'd have to go to that branch, you'd have to sit and wait to talk to that branch manager and personally deliver that check to that branch manager in order for you to deposit that check. And that's the way healthcare works right now, and it shouldn't be that way. But if we were to design a new system, what would we do? The next slide. We would emphasize primary care. We would emphasize that part that we interact with the most, and also the part that is most likely to positively affect our health. And so what we want to do is change from the pyramid on the left that we currently have to what we have on the right here. And free doctors to care for us the best way possible. And direct primary care does that. What Senator Colbeck is proposing does that. It allows us to do that. And two additional things I would just mention on this slide is we have Blue Cross Blue Shield of Michigan is promoting their patient-centered medical home initiative. That is an improvement within the current system, but it's still within the current system. It doesn't remove the bottleneck. They've invested a lot of time, effort, money in that initiative. It is, like I said, an improvement in the current system, but they are reluctant because they're so invested in that model to actually say that direct primary care is better. Also, from a hospital, hospitals do amazing work in the state. We have some great hospitals. If you need a heart transplant, you need heart surgery, we have great physicians that can do that, great places to go. But a hospital executive that looks at this slide, it would scare them to death because we are affecting their revenue and we are affecting what is cost to us, but revenue for them. So that's why our existing institutions want to continue with the status quo. The next slide. So we've freed providers. It's good for providers. How is it good for patients? Well, the governor talks about providing value for money in everything that we do. And for patients, through direct primary care, through Senator Colbeck's plan, we now provide that value for patients. We give patients tremendous power through direct primary care. The patient now is taking money and directly paying their provider for care. If that provider does not provide good value, that patient can go somewhere else. And now you have doctors competing for Medicaid patients. What doctor competes for Medicaid patients today? None of them do. So now if that doctor has long wait times, if that doctor is not listening to that patient can just go somewhere else and take that money with them and go somewhere else to get better care. And this is not a left, right, center issue, Republican, Democrat. This is an issue of, are we actually helping people? And through this model, we finally can. So it's good for providers. It's good for patients. What about the state? I cannot emphasize this enough that this plan will be a game changer for Michigan. This would make Michigan a leader among all of the states in the country. This plan is better changes the system in ways that no other state has been able to do. Not Massachusetts, not Utah, not any of these other states that so-called fix healthcare. And we would turn Michigan into a model for the rest of the country to follow. All of the states would be looking to us. We would be a leader in something for once, instead of on the front page for something negative. And we also, on the next slide, you can see we've now empowered patients, we've empowered providers. So now those parties need better tools for communication, better tools for tracking, better tools for care coordination. So you have all of these healthcare startups around the country and all of these various startup incubators or accelerators. And they want nothing to do with Michigan right now. But if we actually created this model, put this model in place, they would all flock to Michigan because we finally have a marketplace for which they can provide their goods, their better solutions. We're therefore creating a new industry, new jobs to come to the state. We're not putting any tax incentives in place. We've homegrown, developed a new industry in this state. Now, the next slide, please. Blue Sky Health is ready to go here. We talk about direct primary care with employers, with patients every day. We are not some fringe organization. We've been around for a while. We're actually one of the first 100 practices in the state to receive the patient-centered medical home designation. Our founder actually sits on the primary care leadership committee for Blue Cross Blue Shield. But we are staking our reputation. We are putting our reputation on the line for Senator Colbeck's plan because we believe this is better for patients, providers, and Michigan. So it's up to us to demand that our leaders act. It's up to us that the Senate acts to make sure that they act. And it's up to us all to push to reinvent Michigan. Thank you.